I'm Yvonne Foley, Chair of Tooleybuc Local Health Advisory Committee, and this is Tooleybuc. It's a delightful spot on the Murray River, the furthest western outpost of Murrumbidgee Local Health District. It's the hub for the satellite towns of Goodnight, Kylight and Coralie, which, when combined, provide a catchment population of about 1,000. This is serviced by the Tooleybuc Community Health Centre, staffed by 2 community nurses, job sharing Monday to Friday. Our option for a doctor is Balranald in New South Wales or Swan Hill in Victoria, each 45k away. So we do value our community health centre. While we may consider ourselves geographically disadvantaged for some of the inpatient services that MLDHD may offer, we're fortunate to be able to take advantage of clinicians in women's health, mental health, social work, diabetes, aged care assessment team, occupational therapy and palliative care, all who attend our centre. As well, we receive services from Swan Hill District Health by their rural outreach program. They provide podiatry, a dietitian and speech therapy, the latter under a funding agreement with the Warrkul Shire. The manager of this rural outreach program is a member of our Health Advisory Committee, and we use this close relationship with her to facilitate special activity days for health promotion programs using our local venues. Our next activity day is coming up soon. It's by popular demand a repeat of a Continence Day. I believe our achievements are the direct result of the selection of our committee members. They wear several hats within the community, variously holding positions on preschool, school P&C, netball and football social club, CWA and senior citizens. And the presence of the Warrkul Shire Councillor on our committee is valuable. Within this group, the satellite communities also have a voice. This eclectic group ensures we have a close link with varied demographic groups and an open line of communication from them. Now, all this sounds great, but having no local newspaper or radio, we still had problems disseminating information to the wider community. After debating this problem at a meeting, we considered creating a community database. We presented our idea to MLHD exec, although then it was Greater Southern Health, and were given permission to attend. Step 1, we wrote a letter to the community outlining our purpose, explaining our need for an easier and effective communication, and assuring them of our strictly binding confidentiality agreement. An assurance was also made that the details would be used only by the Tooleybuc Community Health Service. No one else would have access to the database. We attached a questionnaire requesting one person in the household to be the contact point, and that person to list all the persons in the household in the sex and age groups we had listed. The contact person was to provide details of method of contact, for instance, email, our preferred and most cost-effective option, phone or SMS, and our least preferred, the costly Australia Post. Even though the completion of this form was entirely voluntary, it was strongly advised that we also obtain a consent form. So page 3 was added as a simple consent form. Step 2 was distribution. And this is where our eclectic committee came to the fore. Each went armed with letters and forms and pens and spoke to their special groups, handed out the forms and encouraged the interested persons to complete the form on the spot. We also provided forms and secure collection points at the health centre and into the hands of the postmistresses at Tooleybuc, Goodnight, Coralie and Kylight. Now, while we have these great ideas, there was a bit of a deficit in our IT ability. So we sought some help from allied health worker in Deniliquin. and our project gained momentum until she became unavailable due to a career change. However, fortune does favour the brave, and it was suggested that MLDH Systems Development Manager may be able to assist. He was, and he did. However, he did throw a spanner in our works when he suggested that the questionnaire form be modified. I mention this now to save anyone else this problem. We had overlooked the fact that this database was an evolving one, and by ticking, say, an age group box, 5 to 12, it would become irrelevant as the years passed. So the modified question became date of birth of household contact member. We followed the systems manager's advice and made a reverse step back to step 1, obtained the fresh data and then reloaded it. We are also mindful that new residents come into the area, and as they join groups, they're encouraged to participate. Finally, we're getting closer. We are currently learning how to extract information that will enable us, by using a few keystrokes, to target specific groups. For example, we may need a list of the sexually active females in the community. Knew that'd wake you up. We'll request a list of females 17 to 75, although personally I'd change those margins. And from that list, we'll send off emails to advise them of a topic of significant interest. We believe that by using these methods, it will demonstrate our interest in promoting a healthy lifestyle across the whole community and improve accessibility and utilisation of the many services that the Tooleybuc Community Health Centre offers. Written and spoken by Yvonne Foley. No animals or children were harmed in the production of this video.